Yeah, Nan Nguyen joins us live from Folsom with sleep tips from an osteopathic doctor. Hey.
You're fine, man.
Good morning. This was not on purpose, but this is a great segment that ties in, I think, beautifully with what Cambie is doing. We're talking about osteopathic medication, or medicine, actually. And we are actually with Dr. West. He's out here in Folsom, and I wanted him to explain to me, or to all of us, I was reading about it, the difference between, what the difference is between, say, an MD or a DO, which is what he does. So I'm just going to flip around. And while he's doing this, we're specifically in this segment, we wanted to talk about different ways that osteopathic medicine treats issues with sleep, right?
Sure. Well, thank you. Yeah, I'm going to be treating Kathleen, who came to me with some sleep problems and some neck stiffness, and I'm going to use a very gentle, subtle technique. And as an osteopathic physician, or DO, Doctor of Osteopathic Medicine, we're trained how to use our hands to be able to help the patient's injuries and illnesses and help prevent them, and more of treating the whole person rather than a specific organ system or disease process. So what I'm going to do is I'm going to gently raise her head and use my fingertips to put pressure at the base of her head and where the base of the neck is, and let gravity and what we call acupressure, auto pressure, take the tension off of her muscles so that she can relax, and which will also help her with her sleep problem. And this is with minimal to no movement other than letting the muscles relax.
That's nice, and I think that's probably what helps somebody sleep a little bit more easier or better, because they're not tensed up.
Yes, and it decreases the pain and muscle stiffness and spasms that would potentially keep that person from sleeping and not using a medication, hopefully.
How regularly would somebody have to come in to kind of really start to feel the difference between what you're able to provide?
It can happen after the first treatment. So this is, in the interest of time, I could spend 15-20 minutes just doing this technique until I finally feel the release where the muscles do relax and go back to normal or neutral. And then the patient's usually falling asleep by then, too.
Are you almost ready to fall asleep?
I'm very relaxed.
And there's one other technique that I do. This is actually tilting the head a little bit and using the base of my wrists and having her close her eyes and breathe slowly. And this causes no pain, and is also for people that may be nervous about being adjusted with active manipulation, that I think we're going to get to in your next segment.
Yes, speaking of which, so this is just the beginning. I feel like there's not enough time to get to it all, but in the next one, anybody, Cody, if you're in there, listen up. Issues with neck, back pain, those sorts of things, osteopathic medicine might be an option for you. So he's going to talk a little bit about treatments for that. So stay tuned for that in the next hour.
All the above?
That'll help, right? Exactly. Thank you so much, Nan. We'll check back in with you a little bit later on for some more tips.